There were some 36,751 vaccines administered in our state hubs yesterday, plus, of course, those administered by community pharmacy and those administered by GPs in GP clinics. That brings us to 89.4% of the population that is 16 and over have now had a first dose of one of the COVID-19 vaccines, and 67.2% have had both the first and the second dose. So we are well placed to reach our target of 70% double dose and to open up as of 11:59 p.m. Thursday evening, which is a great credit to the work of so many Victorians, now more than 5 million that have had at least one dose. And beyond that, we remain on target. That sort of 30th, 31st around that time, just before Melbourne Cup, we are on track to be reaching that 80% double dose target and delivering all that the roadmap promises at that point. That too is well and truly ahead of schedule, because Victorians have, in record numbers and in record time, come forward to get their first and their second dose. I just want to commend, though, to everyone who has got a second dose appointment. If you can bring that forward, please do so. We've had a number of interval changes. There are a number of appointments that are outside that interval. If you can bring it forward, then that's terrific for you and for everybody. If beyond that, though, this Thursday night will come and go. Melbourne Cup Day will come and go. 80% will come and go, but second doses will always be important for those who need them. Honouring those appointments right the way through is incredibly important, because it's only with 2 doses that you are fully safe against this virus. And the other issue, of course, is if you are on the fence, if you're thinking about whether you will or won't get vaccinated, then please go and book a first dose appointment. Don't become one of these people that are in hospital that, for whatever reason, were not part of the vaccination program. To that end, we do acknowledge and understand that our community is a particularly diverse place, and there are many groups for many different reasons that may not necessarily be vaccinated to the level that the broader community is. That's 70 and 80, and indeed, from a first dose point of view, very close to 9 out of 10 people over the age of 16. That's why today I'm announcing a $21 million package to do even more work. There's been a lot done to this point, but to do even more work to support those who may face additional barriers to being involved in that vaccination program, to get their first dose and their second dose, to be protected for themselves, but also to play their part in protecting all of us. Whether that be people living with a disability, youth that are at risk, seniors, culturally diverse and multi-faith different communities, social housing residents, and of course, these are only examples, and of course as well, victim survivors of family violence. That $21 million includes $13 million to support Victorians with complex needs. So, to give you another example, young people in the child protection system, social housing residents, those living in supported residential services. This funding will help to book appointments, promote existing transport options, or arrange alternatives where that's needed, or to offer respite or occasional childcare in suburbs with low vaccine uptake. As you've seen, we've taken this program right into local communities with pop-ups and micro pop-ups, literally neighbourhood vaccination activity, end of your street vaccination activity. That's one of the reasons why some local government areas of significant concern to us only a few weeks ago have gone from 50% single dose to over 90% single dose in just a matter of weeks. We've had a really focused, a really concerted effort, and it's just been wonderful in terms of the outcomes we've been able to achieve. But that last minute push, that push to get to those really high numbers, that has to involve going back and doing more in all of the targeted efforts that you've done to that point. That's where this package comes into its own. There are a number of other elements to this, and I think you've got a media release that takes you through all of those. But hopefully that's seen for what it is. It is that last minute push to add to all the considerable efforts we've already put in place to try and get these vaccination levels as high as we possibly can in every part of the state, in every different group, in every different way. I'm now going to ask Naomi to speak to the kind of chain of transmission issues and a bit of an epi picture, but also she's going to talk about pop-ups and some of the increased and additional vaccination access opportunities in lots of different parts of metropolitan Melbourne and indeed into regional Victoria.